Thank you, Chairwoman DeGette. Ms. Chang, thank you for being here today. It's great to see you again. As an emergency physician, public health expert, and chair of the Congressional Hispanic Caucus, I am encouraged to see the Biden administration working to reverse the failed policies implemented by the previous administration based on hate, fear, demonization of immigrants, cruel, intentional, uh, traumatizing separation of children from their mothers that harmed children and made things worse. Policies that were supported and justified by Republicans that were here in Congress and that are now here in this hearing, who are now saying they are concerned. Look, last Congress, I introduced legislation to combat these harsh policies. My bill, the Humanitarian Standards for Individuals in CBP Custody Act, creates basic humanitarian standards for health, nutrition, sanitation, water, hygiene, and shelter for migrant children, women, elders, and families in the custody of CBP. This bill passed the House, and every Republican on this hearing who voted against these humanitarian standards, voted against basic humanitarian provisions like diapers, age appropriate food like baby food, basic health screenings to prevent children from dying, basic provisions worthy of human dignity. So don't come now with your newfound concerns about the plight of children in U.S. custody when you were justifying and defending the policy of ripping children from their mother's arms, especially now when the Biden administration has improved the situation with a professional and humane approach. So now, Ms. Chang, in regards to solutions in recent months, we've seen the Biden administration working to help ensure that children are safely and swiftly transferred from CBP to OR facilities. Ms. Chang, can you explain why these facilities were necessary and why they are better for children than the alternatives?
Uh, Thank you, Dr. Ruiz, and let me first just thank you for your long championing of these issues and for all the work that you and the CHC has done to support these vulnerable children. As I mentioned earlier, I had the chance to visit one of our CBP facilities, and it was clearly, and I think the CBP officials there would tell you the same, these facilities were never designed for children, nor were they designed for
And
children
so
to
why
stay.
are these ORR facilities better?
So we have in place basic humanitarian standards where children can have recreational activities, where they get case management first and foremost. That is critical. They all get medical care. They
Great.
get
So,
mental
so,
health
so they're
screening.
specialized in child welfare.
That's right.
And so, but news reports have detailed that in certain cases, children are sleeping in rooms with hundreds of others, especially in these large facilities. And I'm concerned about the prospect of any child staying for a long period in these type of facilities. So, Ms. Chang, how long are children staying at these facilities now? And can you speak about efforts to reunify them with families as quickly as possible or move them into licensed facilities?
Yes, Dr. Ruiz, we're happy to get you detailed information about the length of stay for different children in different facilities, but I can tell you that we are committed to doing a couple of things. We have specialized case management teams. We have case management leaders with a great deal of experience working to organize their staff so that no child stays one day longer than they need to, and that if they have complex cases that require more time, they are moved to licensed facilities.
Thank you. And look, we all know that the smaller the group, the more attention the child can take to meet their needs. And so these large facilities are not the ideal. We want them into the smaller facilities. Look, I've spoken with President Biden and Secretaries Mayorkas and Becerra about developing a civilian humanitarian response team to help with border crossing surges. The civilian humanitarian response team would be modeled after the DMAT team, the Desert Medical Assistant Team. The civilians will predominantly be composed of caseworkers, social workers, nurses, but not limited to those. The civilian humanitarian response team would be able to rapidly deploy to areas to quickly process unaccompanied asylum seeking children, find their relatives, ensure they get tested for COVID, meet their quarantine needs, and assist them in their logistics of transportation, access to counsel, returning for their immigration court date. Ms. Chang, would a humanitarian civilian response team help address the needs associated with border crossing surges?
Absolutely.
Thank you. Thank you, Ms. Chen. I appreciate your efforts and the professional, humane activities that you are doing to improve the situation. There's been great progress, and we're here to ensure that children are our priority in this matter. With that, I yield back my time.